If you're anything like me, like learning anatomy through sports injuries, this is episode 30, Neuro Time, Ryan Shazier, December 4th, 2017, Bengals, Steelers, Monday Night Football. Ryan is in the linebacker spot, going to come down, lay a big hit, but he's going to instantly grab his back, roll over onto his back, and call for help. That's not good if you're Ryan Shazier. So let's take another look. He's going to come down, lower his head, and that's straightening out his cervical spine. And he's going to make this tackle, but that's going to deliver a large force through his helmet into his lower back, which we'll see was what was affected. So, spine. He had a history of scoliosis, which I didn't know. Could have been a predisposing factor to an injury like this or put him at a higher risk, but that's up for debate, I guess. But it was his thoracic lumbar region that was affected, likely a fracture. He did have a spinal contusion, which is a crush or bruise to the spinal cord, and it was an incomplete injury, which is really best case scenario for a spinal cord injury. So there's a billion spinal tracts. We're only going to talk about three because these are the ones that are really important. So the corticospinal tract, I got it in red. It matches the red in this photo. It goes from your brain to your spinal cord out to your muscles, and that's for movement. All right. So Ryan lost movement, which likely affected the corticospinal tract. Dorsal column is an ascending tract, so it goes from your body to your brain. So that's responsible for vibration, proprioception, and fine touch. He didn't have any feeling, so likely this was also affected. And the last one, the spinothalamic tract, pain and temperature, crude touch, and pressure. Again, he couldn't really feel anything at the time, so it was likely affected. So what did they do for Ryan Shazier? Well, he went to the hospital immediately. Of course, he was carted off. 3 days after the injury, he had a spinal stabilization surgery. Now, they do this normally when there's instability or a fracture. It wasn't really reported on which one it was, but they did perform the surgery. And he started physical therapy with the goal of returning to sport. He wanted to play football again. So he started inpatient rehab at the hospital for about 2 months. And then he transferred to outpatient therapy, which he was going to do basically as long as he needed because he's a high level athlete. His focus was gait training and strength. And we know that it's a long road, but in April of 2018, he walked onto the NFL draft stage, which at the time was a monumental thing, especially for his condition where he was in a wheelchair for a while before this. So in November of 2018, he started jogging, which kind of showed he was making good progress to return to sport, but he had to have high level movement. So through 2018 to 2020, he was on the IR or the PUP list. And in 2020, he did decide to retire. And since then, he's become a staff member for the Steelers. And he was actually a large advocate for alternative pain management. He didn't like opioids, so he was using the sticky icky, the devil's lettuce, also known as cannabis. That is Ryan Shazier.